This is the Hudson Valley Station for great songs and magic memories. 920 WGHQ AM Kingston and 92.5 W223CR FM Kingston, New York. We're streaming through our website, WGHQ.FM, and you can listen on your smart speaker when you say play WGHQ. This is Magic 92.5 WGHQ with another hour of great songs and magic memories.
Good morning. You're now listening to Kingston Community Radio, airing on FM 92.5 and AM 920 WGHQ, Kingston, New York. This programming is brought to you by our listeners and corporate underwriters who are interested in presenting local community radio. The opinions expressed on this program do not represent those of Pamel Broadcasting or Kingston Community Radio. Listeners are encouraged to send in $10 per month to help bring this program to you. Mail your contributions to Kingston Community Radio, Post Office Box 4364, Kingston, New York 12402. For more information or to donate online, visit our website at mykcr.org. Good morning, this is Dan Gatis, and thank you for tuning in, sharing the morning with us, and being a part of today's program, Medical Mondays. And it's Monday, March 15th, 18 degrees this morning. It is cold. And today it's going to be sunny, though, with a high of 36. Tonight, mainly clear, a low of 16. And Tuesday, partly cloudy in the morning to mainly cloudy during the afternoon, with a high up to 40. And Tuesday night, variable clouds with some snow showers Tuesday night, low near 30. And Wednesday, cloudy, high 48. And Wednesday night, mainly cloudy with a low of 33. And we'll be right back after these messages.
Thanks for starting your day with Kingston Community Radio on 920 WGHQ AM Kingston and 92.5 W223CR FM Kingston, New York. Magic 92.5.
Everyone is talking about healthcare these days. America spends twice that of other developed countries on our healthcare system, yet our health ranks near the bottom. How can we stop spending so much and getting so little? By shifting to a system that gives more patients access to strong primary care. Primary care can help make America healthy again. To learn more about the benefits of primary care, visit www.healthisprimary.org. This message is brought to you by America's Family Physicians.
Hey, hon, what you doing with your phone?
Do flowers have best friends?
I don't know. Hey, look.
Whoa.
Some answers can only be found in nature. Discover the unsearchable. Visit discovertheforest.org to find a trail near you. Brought to you by the United States Forest Service and the Ad Council.
Kids dream big. Protect your child's dreams by keeping them healthy. If your son or daughter is age 11 or 12, the American Cancer Society recommends giving them the HPV vaccine to help prevent HPV cancers later. Learn more at cancer.org/dreambig.
Hi, this is Eleanor Arrow from the town of Ulster, and I support Kingston Community Radio, and so should you.
And we're back. You're listening to KCR, Kingston Community Radio, WGHQ 920 on your AM dial, 92.5 FM, and streaming online at mykcr.org. KCR is talk radio. Call-in show, 331-9255 is your number. And this is Medical Monday, and let's say hi to Dr. Eric Stanberg, who is in the on-air studio, giving us all kinds of greetings and heads up.
All right, good morning. Welcome to this morning's show, March 15th, 2021. What happened last week with, smell of spring was in the air? Now it's dark and cold again, like February.
It is dark and cold. Now we're back an hour. Now we'll see the sun rise at around, 8?
Yeah.
Close to 8 now, huh, right?
It's an interesting discussion about daylight savings. Is it something we should continue to do? Or
I know, it is an interesting discussion. And we talk about it every time we change the clocks.
That's right. But it's like a lot of things. It's probably here to stay because it's been part of our.
It's usable. I think it's functionally usable. It's the best of. However you would say it,
the best way to go about it.
Yeah, right. Yeah, it's the best law of average, I guess.
Yeah. I think that when I was a kid, more kids walked to school. We don't, and the idea that the kids would be walking in the dark and now they're going to be walking in the light. I
right.
thought that was kind of a good idea.
I think so too, yes. And I think that's why we did it, right?
Probably one of the major reasons.
Yeah, and it had something to do with farming too, but I can't remember.
Farming?
Yeah, I don't know. But
we'll wait for Robin. She'll know. She's all about farming.
Know.
Robin's always talking about growing up on a farm, and I'm always telling her about. I'm waiting for work because I'm stuck behind some farmer's tractor, and
yeah.
And she goes, he's getting food for you.
That's
I'm like,
right.
all right, back off.
And that is a good point. Point well taken.
All right. So I'll be here until 9 a.m. Call-in show, 331-9255. We're going to talk about various medical topics today. And I thought we would start with one of our general themes of the entire show, which is preventative care and preventative health, and trying to approach this problem in what is commonly referred to as an evidence-based way. Taking our knowledge, our science, and medical research, and finding out what really is important and what is helpful and what is necessary to prevent serious illnesses, to prevent negative impacts of health, and promote wellness and healthiness. And the right way to approach this is to actually look at age and gender. In other words, for obvious reasons, what's recommended for a woman is not the same as what's recommended for a man. And I thought we would start with just kind of focusing on women of reproductive age, because that is different than women who are no longer of reproductive age. So these are various things that are supposed to be recommended. And when things are recommended, they're given what's called an evidence rating, A, B, C, D. And it's kind of common sense. A means yes, very good evidence. D means no, don't do it. And B means probably good. And C kind of means the jury's still out and it's up to the provider and the patient. So, for example, going down a list of common recommendations on things that we should do for a woman of reproductive age from a preventative point of view. Good morning, Robin. I was talking about being stuck on behind a tractor.
I know, I heard.
Oh, you heard? Okay. Well, was daylight savings for farmer reasons?
I think it was, but I'd have to look up the specifics.
All right.
Yeah.
Well, anyway. All right, so these are things that are A ratings, things that should be done. Screen for tobacco use, unhealthy alcohol use, and unhealthy drug use. Well, that, again, seems like a simple thing, right?
Yeah.
All right, and we do it. And I look at my own practice. How do I do this? But this has been for tobacco use, it's an A rating. For alcohol and drug use, it's a B rating. It says multiple reviews demonstrated effectiveness of counseling and treatment for tobacco cessation. So anyway, so that also is a theme in preventative health. And I remember this in my medical school. They said to us, or at least a few of my professors and teachers said, we should talk more to patients and do less. So it's not a new concept. This is 30 years ago. The idea that as physicians, as healthcare providers, there's a lot of weight behind what we recommend to people, and we should spend more time counseling them on some basic decisions. So what gets an A rating is to screen and treat people for for tobacco use, and also to screen people for alcohol use, and then the third category is unhealthy drug use. So what else gets a pretty good rating? A rating. This was interesting. Screen for HIV in people 15 to 65 years of age. 15. All right, so a review and studies demonstrated lower risk of death and AIDS-related events in people who start treatment early. So that's the whole idea. So I'm looking at my own practice saying, do I do that? I probably should do a better, a little more thorough job of that, because that's the A rating. The evidence shows that is effective.
You do that with the patient's permission, though, don't you have to ask?
Well, patients in my room, in my office, in my examination room, there's already kind of a permission there. It's me and the patient. They're here for a preventative visit. It's okay to, for me to gently ask some personal questions and see if they have higher risk of HIV infection. And then maybe test them if they want. A lot of people do want to be tested. So it's probably something that should be done more. I had one of my Suboxone patients tested positive recently, and she was actually tested when she went into more of like a rehab, and that's when she got diagnosed. So, they were doing their due diligence. I can't believe I'm starting to use that phrase because I don't like that phrase, but
everything else, once you know, then you can treat it and you can, be aware of it.
Yes. So for people between 15 and 65 years of age, it is an A-rated intervention to screen people for HIV risk and test them if indicated. All right, so those are the A's. Tobacco, HIV screening, and then actually it's a B, alcohol and drug use. What are the other B's? So B means it's probably good and should be done. It's just that it's not an A. It's kind of like getting a good grade in school. You did very good, but it's not an A.
Okay, got it.
Got it. All right. B, screen for obesity in adolescent and adults. Refer adults with a BMI of 30 or greater to intensive behavioral interventions focused on healthy diet and exercise. So again, that sounds like a reasonable thing to do. And actually, when I have younger patients, I always say to younger patients, I say you should really come in once a year. Even though you're young and healthy. I mean, and when I approach these patients, that's one of the things I'm looking at. Because I'm trying to counsel them, when they're 30, to start making some changes. And I always say that, if you're 30 and you put on 3 pounds a year, by the time you're 40, how many pounds is that?
Right, a lot.
30 pounds. All right. It's just 3 pounds doesn't sound like too much.
No.
All right. A B rating, screen for depression in adolescents and adults when systems are in place for diagnosis, follow-up, and treatment. That's one that sometimes patients get upset about. There's a tool we use, which is called the PHQ-2. I wish I could remember right now what the PHQ stands for. Patient Health Questionnaire. That sounds good. It's a 2-question screen, so it's very quick, and we do it fairly routinely. So don't be offended if someone's asking you those questions. That's
a lot of that going around.
Yes, there is. It's a challenge in my office what to do, though, when it's an issue, and it says right here the recommendation is not so much to just screen for depression. It says when systems are in place for diagnosis, follow-up, and treatment.
Yeah.
So now what? The visit, in a way, is a preventative visit. There's things to go over, and now we've kind of come up with something that takes time. Someone's screening positive for depression. In my office, we now have a ability to refer people for counseling that's done via the telephone, and it's been very, very successful, and I'm very happy that I have this as a tool for my patients, and I'm actually kind of proud of the organization for providing that. I think that's an excellent thing. So that's, because I also want to avoid a scenario where it's just kind of like, oh, you're depressed, here's some Prozac. It's not that simple.
No.
We wish it was that simple. This is an interesting one. We don't talk too much about. It's a B rating screen. And remember, we started with the conversation for women of reproductive age. So that's, and then we kind of expanded some of these recommendations because obviously they
apply to everyone.
Yes. But this one is for women. Screen for intimate partner violence in women of reproductive age. That could be a tough one, and but that's a B rating, which means there's pretty good evidence that it's something that should be done. This is an interesting one. It's a B rating. Screen for hepatitis C virus in adults 18 to 79. Because hepatitis C is common, and it's actually treatable. And if it's not treatable, the outcome could be terminal. Hepatitis C can kill the liver. That's called cirrhosis. And whenever you have cirrhosis, you also have a risk of liver cancer, because when cells are dying and turning over, one of them can become cancerous, and then you have liver cancer. So the idea that we should screen earlier. Now, the recommendation that I've been following was to just kind of screen baby boomers, people born between 1945 and 1965. And this article is clearly recommending an expanded
Screen.
This is a good, interesting one. Category B, screen for gonorrhea and chlamydia in sexually active women younger than 25. Gonorrhea and chlamydia. Chlamydia in particular is very common. It could be without symptoms, particularly men, when men cannot have, possibly not have symptoms. Women also can frequently not have symptoms. So what does it cause? Just to keep it very simple. These conditions can cause urethritis, which is kind of a type of urinary tract infection, frequent urination, painful urination. They can also, for women, can inflame the vaginal area, cause what's called a cervicitis, inflammation of the cervix. However, if it's not treated, it can lead to more serious outcomes. It can lead to fertility problems. And it can also lead to something called pelvic inflammatory disease, which basically means that the infection has moved to the ovaries and the tubes.
Fallopian tubes?
Yes. I was going to say eustachian tubes, but that's the ear. I'm glad you're here to be the layperson.
Me too.
Yes. Anyway, so the point is it's important to screen for this. And I find this interesting because I guess we're building up to the recommendation for pap smears. Good. And we'll get back to that.
So how do you screen for that? You just ask a question?
No, you have to test.
So it's a swab?
Well, it's changed, by the way. So it used to be a swab. You needed to do a vaginal exam and a swab that way. You can test off the urine now. So it's actually easier to test. But you could also still do a vaginal swab. All right, so we're on to C recommendations, which means, I'm the doctor, you're the patient. We probably should still do it. Screening pelvic examinations for women without symptoms. When they're not, here we go. But, we've been doing that for decades. Go to women. Go see your gynecologist. Go see your women's health provider. Go to Planned Parenthood, whatever.
Yeah, but they stopped paying for it every year.
I think. I think they did. Yeah, I don't know if there are certain guidelines, but all right. And what else gets a C? Okay, and then something about breast cancer screening. Remember, this is for women of reproductive age, so women between 40 and 50. And we had Dr. Kersey on a couple weeks ago talking about that population. And she pretty clearly said that women in their 40s should be screened for breast cancer. But there is some controversy about that. So what do you think? Do you find that helpful?
Yes, very. This whole concept of you counseling and speaking to your patients when they've cut down on the time that you're allowed to spend with them is difficult. That's
right. There's something that's been around for a long time called the Choosing Wisely campaign. It kind of sounds what it's like. It's a kind of a think tank, so to speak, that issues recommendations that are supposed to help someone like myself or other healthcare providers choose wisely. And these are their recommendations. Do not perform annual pap smears or HPV testing on low-risk women. Okay, so I cut out some words there to keep it simple, but for growing up and when you were a young adult, right? It was get once a year, get a pap. Once you get, it turns out that's in most women that's not necessary, and it's gotten even more complicated with HPV. HPV is a really interesting topic because when I was in medical school, this idea that somehow HPV was the cause of cancer was very hard for people to accept. What do you mean the virus causes infection? But the evidence was growing that viruses, in addition to maybe causing an illness, like an infection, can also cause cells to change and then lead to cancer. So there's complicated guidelines on how to screen a woman for HPV. But if a woman does not have HPV and her pap smears have been normal and she otherwise feels well, doesn't have abnormalities of bleeding, for example, she does not need annual pap smears. And most of those women are okay going every 3 years. Here's an interesting one. Do not perform pap smears in patients younger than 21 or women after hysterectomy for benign disease. Okay, so that, a 17, 18-year-old young woman, the idea that maybe she needed or wanted to go on birth control, the recommendation was she had to have a pap as well to start the treatment. And then the evidence kind of came along that you don't need to do that until they're 21. So what's the downside? I have plenty of, it happened just last week, a couple of relatively young women came in for various visits, 23, 24, and I asked them, doing my due diligence, like, in addition to the reason why they're in the appointment, but talking to them about their women's health, saying, did you ever go? And they kind of, I think it was two of them said, no, they haven't been there yet. So I took advantage of that opportunity to be a primary care advocate and set them up with a gynecology visit on the other half of my building. To varying degrees, primary care providers will do women's health. So it's okay to receive that from your primary care provider if that's what you choose, and your primary care provider does that as part of his or her practice. Was that clear?
Yeah.
Any comments?
Well, you don't provide that as a service usually?
We moved into this space in 2016. The other half of the building has three wonderful gynecologists, Dr. Hines, Marcel Hines, Dr. Henderson, Kimberly Henderson, and Dr. Meredith McDowell, and nurse midwives are over there, Julie Denny and some others. And I think they do a wonderful job. And I think that I got enough to do. Look at, how I've been rambling so far. You got to remember, I got a 15 to 30-minute appointment. So I'm usually willing and preferring that they go over to the gynecology side of the building because I feel like I have enough in my visit. And that also interferes with billing too, by the way. Some insurance companies would not. We used to do something called over and under. For a woman of reproductive age. So she would come in for one preventative visit where we would discuss other things, and then she would come back for a separate visit for her pap and pelvic. And some insurance companies stopped paying for those. They said that's two preventative visits, and you should do it all in one visit. So what happened? Some people... that one of the things that kind of made me say, you know what, I'll focus on this stuff, and I have a wonderful gynecology department that I share an office space with. So that's my perspective.
And worked out good.
Yeah. I think that again, I think they're wonderful colleagues. And also the idea of if women after a hysterectomy, when I first started out, they said, those women should still have. Remember, a pap smear is a test of the cervix. If a woman's had a hysterectomy, the cervix has been removed as part of the hysterectomy. So, I don't know. The idea was that you were still going to do a test and do a swab and make sure there was no cancerous cells in there, but there was never any good evidence to suggest that. If a woman does have a hysterectomy for cancer, like cervical cancer or uterine cancer, I guess maybe she should still have an annual exam. Because that's what it says. It just says women who've had hysterectomy for benign disease. It says, and this comes from my organization, the American Academy of Family Physicians, do not perform pelvic examinations on women without symptoms who are not pregnant unless necessary for guideline-appropriate screening for cervical cancer. I'm not quite on. Okay. I think they're saying don't do a pelvic unless you're also going to do a pap, With the exceptions are women with symptoms, obviously you're working something up, or women as a part of their prenatal care.
Would you ever do an internal test without doing a PAP? I mean, isn't that the point?
Well, women can have a discharge, and that's called vaginitis. And yeah, you could do a swab there, and then, depending on the scenario, sometimes the chart is like, oh look, she's overdue for her PAP. If we're going to do this swab to work up her symptoms, we might as well do the PAP at the same time. That could be risky though, because the PAP might come back abnormal because there's an acute problem, and that's one of the things that led to this kind of backing off of doing PAP so often. That you were kind of seeing things that really weren't patterns; they were just kind of fluctuations. So if you did a PAP every year, you were going to pick up stuff. Kind of like the same logic behind, do you need to do a mammogram every year? Or are you going to just kind of do it a little more methodically?
What do you think patients prefer?
I think it's whenever we have a scenario where for decades we were telling women, get an annual exam, prevent cervical cancer. By the way, cervical cancer is horrible. It's horrible, and I've only seen a handful of cases in my career because of very successful public health interventions. And not every woman, but a lot of women took that very seriously, took their health seriously, and for decades went on an annual basis to go have their pap smears. So it's kind of a tough sell to kind of say, you know what?
You don't really need it.
We changed our mind. All those visits and examinations over the years. But once you kind of get into that acceptance stage, they're okay with it. It's more logistically challenging to keep track of something every 3 years and something annual. People are like, oh, I just had a birthday. It's time to schedule my annual. Now it's like, well, when was my last visit? People really can lose track of when their last exam was.
Yeah.
I had one patient swear they just had a pap smear. When I finally got the report, it was from 2004. I was like, yeah.
Seemed like yesterday.
Yeah. And actually, keep finding little stories. I'll say the woman's like 45, well, when was your last pap smear? Oh, when I had my last kid. Okay, how old's that kid? 22. I said, well, I think you're due for another one. So that story happens a lot. All right, where are we here, Robin? By the way, when she just stopped doing this makes most women are rather accepting of, generally a woman after 65 does not need to have more PAPs. There's some caveats with that. She has to have had a couple normal PAPs before that decision is made. But most women are quite okay with that. But I still have some patients who choose to continue to see their gynecologist because it's something, again, it's the value of a longitudinal doctor-patient or relationship. So I think that's good. So I don't stand in the way of that. Do not require a pelvic examination to prescribe oral contraceptives. I think we covered that. That came up here a little bit. Same logic why a woman younger than 21 does not need to have a PAP. Do not screen for herpes in people without symptoms. That's a tough thing because people kind of come in frequently and they say, "I want to be tested, doc." It's I know it's a family show here, but it's kind of an urgent care thing. Some guy comes in at 7 p.m. on a Saturday saying he wants to be tested because guess what? He's got a date tonight, and his partner is saying
wants to be safe.
Yeah, and I'm like, well, I'll pull through the testing, but you're not getting it back right away. You got to plan ahead a little bit here, buddy. So they always get herpes. I really don't recommend screening for herpes. There's no good easy way to do it. The blood work is very inaccurate. To keep it simple, and I just don't recommend it. Someone can test positive for herpes antibodies. Doesn't mean you have it. Maybe you were exposed at some point. Maybe you weren't. And I've had some couples get into really bad arguments because someone ordered a herpes blood test on them. And finally, the last one has to do with breast cancer screening, which is don't use MRI imaging for routinely to screen for breast cancer. And Dr. Curcio talked about that a couple weeks ago. That's really for higher risk women. And I think that almost gets us to our first break. Do you think that cleared up some confusion? We're going to sum it up. What do you think? All right, here we go. This is from the USPSTF, United States Preventative Services Task Force. I have a minute. Breast cancer screening. Yes, for women over than 50. It's an individualized recommendation for women 40 to 49. My opinion is yes. I feel like Lionel Richie on American Idol. Yes. All right, cervical cancer screening. It's recommended for women 21 to 65. Colon cancer screening for women 50 to 74. Again, there's a trend to lower that to around 45. Ovarian cancer screening. By the way, we didn't really discuss that, but that's a D. Unfortunately, we've never proven that. And skin cancer screening is insufficient evidence for or against. But we recommend behavioral counseling to prevent skin cancer. In other words, limit your sun exposure. All right, well, that gets us to our first break. So
Be right back.
Thank you, Dr. Eric Stenberg and Robin Baker. You are listening to KCR, Kingston Community Radio, on AM 920 and 92.5 FM. My name is Dan Gatis, and it is 7:30 a.m., Monday, March 15th, and 18 degrees in uptown Kingston. And today, it's going to be sunny, and a high goes up to 36. Tonight, mainly clear, a low of 16 again. Tuesday, partly cloudy in the morning, and then mainly cloudy the rest of the day. High of 40. Tuesday night, variable clouds with snow showers. Yes, snow showers, low near 30. And Wednesday, cloudy with a high of 48. Wednesday night, mainly cloudy, a low of 33. And we'll be right back.
Thanks for starting your day with Kingston Community Radio on 920 WGHQ AM Kingston and 92.5 W223CR FM Kingston, New York. Magic 92.5.
Everyone is talking about healthcare these days. America spends twice that of other developed countries on our healthcare system, yet our health ranks near the bottom. How can we stop spending so much and getting so little? By shifting to a system that gives more patients access to strong primary care. Primary care can help make America healthy again. To learn more about the benefits of primary care, visit www.healthisprimary.org. This message is brought to you by America's Family Physicians.
Hey, hon, what you doing with your phone?
Do flowers have best friends?
I don't know. Hey, look.
Whoa.
Some answers can only be found in nature. Discover the unsearchable. Visit discovertheforest.org to find a trail near you. Brought to you by the United States Forest Service and the Ad Council.
Kids dream big. Protect your child's dreams by keeping them healthy. If your son or daughter is age 11 or 12, the American Cancer Society recommends giving them the HPV vaccine to help prevent HPV cancers later. Learn more at cancer.org/dreambig.
Hi, this is Cameron Rylance from Kingston, and I support Kingston Community Radio because it's informative.
And we're back, and you're here with us at KCR, Kingston Community Radio, AM 920 and 92.5 FM, 7:32 a.m. and 18 degrees on this Monday, March 15th. Kingston Community Radio is talk radio, and we welcome call-ins. Call-in number is 331-9255. 331-9255 is your call-in number. And let's get back to the on-air studio. Oh, by the way, this upcoming segment of Kingston Community Radio is brought to you by Central Hudson. And let's get back to the on-air studio with Dr. Eric Stenberg and Robin Baker. Welcome back.
All right, welcome back. Second half hour of this morning's show. And thank you, Central Hudson, for sponsoring this second half hour of the show.
They had a day yesterday, didn't they? Wow, was that wind something?
I would say they might have had a day yesterday, right?
Wow.
Yeah. Wasn't that a mighty storm?
I live out in High Falls, and there was a tree that went down. It was like a fluke. This gigantic tree fell down, and it pulled down all of the wires, and 3 telephone poles came down with it.
They should just set up an office in High Falls. There's always something falling down in that place.
It was so windy.
Well, we were going to shift subjects to something that I think has an impact, to make an impact. It's called concussion, because there's a lot of confusion about it. It's in the press a lot. So one of the things we do, like when we talk about subject, we always like to start with a case to kind of explain how it might show up. So I work in urgent care, and I'll leave out details, of course, because it's, but it was a woman who had slipped and landed right on the back of her, on her back and her, in her head. If you understand, if someone's feet go under, they will land. Can you imagine someone slipping on ice, right? They might land on their rear end, they might land on their back or their shoulders, but that the head can also then kind of
snap down
and cause an injury. So she showed up in urgent care in tremendous pain. She had significant photophobia, which means she didn't like the light, or phonophobia, and she was dizzy and confused. We couldn't quite figure out if she had lost consciousness or not, but it was rather impressive how much uncomfortable, how much pain this patient was in. And she was 65. I don't know if I gave her age. So now what, right? How do we approach this? I mean, I felt, the whole diagnosis of a concussion, by the way, is actually not an easy one to make. There's no test to prove you had a concussion. That's one of the reasons.
Symptoms, right?
Symptoms. That's one reason I wanted to bring it up, because when you go to the emergency room to have a CAT scan, it's really not to diagnose a concussion. It's to
make sure you're not bleeding.
Right, or have a fracture or something like that, along those lines. But there are certain guidelines that for us to recommend imaging for patients with a concussion. And then probably the most common discussion for concussion at this time usually revolves around athletics, contact sports, young brains, and the importance and a lot of strong evidence that young brains are affected by concussions because they're still growing. So, do you want to mention a person that you know?
Just a friend of mine fell skiing it's been very good skiing weather. A lot of people are skiing. And, avid skier, skis all the time. And he was saying that, he falls, a lot, like you fall when you're skiing, but he just doesn't, wears a helmet, but doesn't really hit his head a lot, but he hit his head really hard. And he was diagnosed with a concussion.
So did he go to the emergency room?
Mm-hmm.
How old is the patient? I get, estimate.
30.
30. So a young man. And what's he do for a living?
Well, part-time, he's a ski instructor. So,
occupational hazard, huh?
Yeah.
Well, it's a dangerous sport. I mean, but a lot of sports are dangerous. In a way, that's probably part of the fun. That kind of
right
thrill. We always talk about Seinfeld jokes about, things that require helmets. What does he say?
He's like, we don't stop our like skull crushing activities. We just put a helmet on.
All right. So concussion. It's really about 80 to 90% of head injuries. All right. And it's a problem that's really underdiagnosed. For example, in 2013, there were approximately 2.8 million people diagnosed with concussion. The estimate that around 3.8 million per year. So there's 1 million people diagnosed with concussion that don't really seek care. But maybe it's not diagnosed, whatever. And how do you define concussion? Well, it's not easy. What is the... I think it was Duke Ellington who was once asked to define swing. And he said, swing is the thing that it don't mean if you don't got it. You know that song? Don't mean a thing if you ain't get that swing?
Yeah.
So in other words, everyone knows what it is, but it's hard to define, And actually, there's also, these are little tidbits, but a famous jurist, maybe Dan knows, maybe it was Oliver Wendell Holmes, or he was asked to define obscenity. And he said, the quote was, it's hard to define, but I know it when I see it. So anyway, concussion, it's hard to define. It's kind of like most easily a blow to the head, an injury. It can be an injury to the face or even to the neck. We remember the little fine line there between the neck and the skull. It causes neurologic dysfunction. There are many symptoms that can be associated with a concussion. Loss of consciousness, headache. It can cause kind of mood changes. You can have cognitive changes, amnesia, confusion, difficulty concentrating, a fogginess. A lot of people describe brain fog. That's the term that probably has kind of become part of our lexicon. People can sometimes have staring while they're recovering from a concussion. They can frequently have sleep problems. It could be excessive sleep or not enough sleep. Blurry vision, dizziness. I might have mentioned that already. Seizures are reported, but that's one of the many things that should prick up your ears to a more serious workup. Headache is probably the biggest symptom. Nausea. I think I don't know if I mentioned it, but this patient that I had in urgent care was very nauseous. Sensitivity to light, tinnitus, ringing in the ears. She had that as well. The number one cause of concussion are falls. However, the number two cause is getting struck in some way, such as sports or, in an altercation of some sort. Around 25% of concussions are linked to sports. And what do you think gets concussions more? In think of like high school age teenagers, girls or boys?
Boys.
Well, the answer is girls. I don't know why. Maybe. Anyway, so what do you think is the number one sport of cause of concussion for boys?
Football.
What do you think is the number one sport that causes concussion in girls?
Field hockey.
Nope.
Soccer.
Nope. Although they could both do it.
Volleyball.
No. I guess
Softball.
Yeah, you're right.
How many sports are there?
Well, I consider this a sport. Cheerleading.
Oh, because they're falling on their heads.
They're throwing up the 80-pound member of the of the team, throwing her up 30 feet in the air. I mean, it's a serious deal, and injuries happen.
So you're saying it's hard to define a concussion, but what is it?
Right. Well, it's kind of like defining swimming.
It's like the brain swell. I mean,
there should be
the old attitude.
Well, that's called the pathophysiology, and I was going to go into that. But that concussion are symptoms that occur after an injury to the head. That's the simplest discussion. The simplest definition I can think of. You have to have an injury of some sort. People have migraine headaches. That's not a concussion. People get whacked in the head for whatever reason, and then they have a severe headache afterwards. That's a concussion.
I remember my mother always saying, well, you got hit in the head. You got an egg on your head because it swelled outward. She was like, well, that's fine because as long as it's not swelling inward, we're fine. So she was always happy if there was a swelling.
I could see some logic there. But you unfortunately can have both. You can have an egg on your head and some swelling inward. By the way, it's not really swelling. Swelling is one of the, that's very serious. And that's one of the reasons why someone might need more evaluation with a CAT scan. Well, since you asked what exactly happens to the brain as a result of a impact, it disrupts membranes that causes potassium to flow out of cells. Potassium is very important in our body, and it's very tightly regulated. So any transient abnormality of potassium can have significant impact. And then it also involves calcium levels, amino acids. Remember, amino acids are proteins, and your brain has a lot of protein in it. As a result of all that, without getting too technical, it does result in decreased blood flow and an energy crisis in the cells. So, and that's kind of what a concussion is. So that's why the severity kind of varies on how bad the trauma is and how long the symptoms are.
So did you order more testing on this patient?
I referred her to the emergency room. Yes, there was one of the many guidelines for imaging after a concussion is age. And one guideline says 65 or older, you should do imaging. The anatomy changes, the risk of bleeding actually goes up. Some guidelines even say 60 and up. So she met that guy, just right then and there she met the guideline. But I was very concerned about the severity of her symptoms. And I wasn't really comfortable. And she also had some neck and back pain. And even though we could do x-rays in the urgent care setting, if you really want to make sure there's no fractures going on, you could do a CAT scan in the ER setting. That would be it's a better way to determine if there's any cervical cervical neck or lumbar or vertebral fractures. So she actually was. It was a challenging case, unfortunately, because she really didn't want to go to the emergency room. She was afraid of COVID, and she had some bad pulmonary disease, and was on some medications, and it really took some work, to kind of get her into accepting to go to the emergency room. It was a challenge. So symptoms of a concussion can be very transient, but they can last for a long time. Most resolve within 3 days, 72 hours. Adults frequently it can last 2 weeks, but other reports will say months and even longer. Children, this is one of the controversies. They can last 1 to 3 months potentially on the severity. Remember, their anatomy is different. Their brains are still growing.
So getting better in 72 hours with what treatment? Like once you say, oh, you have a concussion, then what do you do?
That's a good point. See, these are good questions. The answer is...
the guy in the movies with he has like a bandage around his head?
No, you don't need that. The answer is not much. The answer is you have had an injury, you take it easy for about 2 or 3 days. You just simply treat symptoms. I think Tylenol is fine. Some people don't like the idea of ibuprofen because they think it increases the risk of bleeding, but I don't think there's real evidence behind that. But Tylenol is a pretty safe alternative. You want to avoid stronger medications like opioids, because opioids can cloud the sensorium and therefore maybe give the false impression that there's some deterioration going on. So the treatment is really just supportive. But really a 1 to 3 day period of rest is recommended. And then what? And then we'll get up to that. But there are just some few risk factors why make someone at risk of a more severe concussion. One is just how severe was the trauma. I mean, that's kind of common sense, right? How skiing is, forget about it. That's a dangerous sport. That guy's lucky. Bumping your head on. I've seen people get concussions from kitchen cabinets. They stand up, they whack their head. But that's usually. I mean, even though that can cause a concussion, it's a relatively mild head injury as opposed to having your whole body fall and then slamming the back of your head on a hard floor. How prolonged were the symptoms? Someone whack to the head. You get confused, for example. How long did that last? And for years, they kind of said, was it 30 minutes or less, or 30 minutes or more? That's kind of a vague guideline. The evidence then really didn't support that was a well-defined thing. But, imagine the kid who, by the way, we use this phrases in football, get your bell rung. Use another, so the idea of the kid kind of coming off this field, and you would see the trainer or the doctor kind of doing some testing, vision testing, watching the eyes, checking the pupils. Really, what we're doing is just sitting the kid down and getting an idea as to what's going on. I mean, because the last thing we want to do is put the kid back in play. There's been a tremendous sea change in how we view that. The whole idea of you're fine, get back out there. So virtually every state has laws now requiring extra training for coaches and trainers to identify concussions. And there are even some states that require kids be taken out of play if they have a concussion. That being said, if you're requiring the kid to be taken out of play with a concussion, let's just not call it a concussion. We saw that in professional football with Patrick Mahomes, where the game before the Super Bowl, he got hit in some way that he was horribly wobbly coming off the field. And when I looked at the injury, it might have been more of a neck injury. But the last thing the Kansas City Chiefs wanted to do was say our star quarterback has a concussion. And they were able to kind of say no, and he's okay to play for the Super Bowl. And thankfully he did okay, but I was nervous as a physician for him. Anyway, so the severity of the trauma, how long are the symptoms? Do you have a history of prior concussion? And this is particularly relevant for kids. And then we see football players, quarterbacks retiring now because they're just, that's it. So the more times you have a whack to the head, the more pre-existing damage there is. And they kind of have an additive effect over time. It just prolongs symptoms, fatigue, fogginess, headache, balance problems. So who should get a CAT scan? I guess that's all the notes I took. We mentioned the age, and really just prolonged or evolving symptoms should get a CAT scan. So if some kid, has a tackle in football or whatever, he comes off and he's kind of confused for about 10 minutes, 15 minutes, even after 30, he still doesn't feel right. He probably does not need a CAT scan. And just remember the point that the CAT scan is done to rule out other things. You don't diagnose a concussion by doing a CAT scan. You're doing a CAT scan to make sure there's no hemorrhage, there's no fracture, no swelling, no fluid accumulation. So that's just something for keep in mind. Because I'll hear people say that, you have a concussion, you got to go get a CAT scan.
Yeah.
It's hard. It's a challenge in my field to not do things. It's easy to do things. It's easy to order tests. I can order tests all day long, order labs, order x-rays. It's a challenge to do.
Who's going to pay for it all?
Well, that's one of the many, many reasons why our healthcare system is expensive. But that's a big topic. But there's a legal component. No doctor wants to be the one who says a test is not necessary, and that small chance that he or she was wrong. We hear those stories too, right? The doctor said it was nothing. Well, guess what? It wound up being pneumonia, something like that. I never say it's nothing. I might say I think it's okay. I think it'll get better on its own. Let's see how you do. But I don't go in and say it's nothing. So I don't know. Have you ever heard a doctor say it's nothing?
Well, because it's something, even if it's not like something terrible.
Yeah.
It's obviously something. You're having symptoms.
That's right.
Is it common for there to be swelling?
Not with a concussion. There's fancy testing that and they study this. MRIs, what's called a PET scan, other type of flows in the world of research for concussion. And that movie Concussion talks about that, throwing evidence that there were, long-standing damage from concussions. But no, if you're doing a CAT scan and there's swelling, that's not a concussion. That is a cerebral contusion. You could, damage to the brain tissue that's causing swelling, and that's a completely different ballgame. That person would be admitted and monitored very closely, and in the worst case scenario, there would be increased pressure, and yes, intervention might be required at that point. Drains and what's called a craniotomy, where they literally take out part of the skull and relieve the pressure. It's serious stuff. So,
and that's all diagnosed by symptoms. Telling the difference between.
Well, if I had a patient with a concussion, first of all, greater than 65 and maybe even greater than 60, or had prolonged symptoms, 30 minutes has gone by and they're still,
out of it,
so to speak, I would recommend a further evaluation. And yes, I think once they get to the emergency room, it's pretty easy to order a CAT scan. The patient asked me that, on Saturday, can't you just order a CAT scan? I said, no, it's Saturday night in an urgent care. I even if I could, you're not going to get it till Monday or Tuesday, and then it goes through your insurance approval process. So it wasn't an option.
Right.
So I was able to follow up. So she went to the emergency room. She had her imaging. It was all better. Just a little time and observation. Her symptoms stabilized, and they were able to safely discharge her. But it was a challenging case. Yeah, I'm glad. That's another something sometimes you'll hear from patients. Well, the doctor said I need this test and it didn't show anything, and I'll say to the patient, "Good, I'm glad it didn't show anything. What'd you want? A lung tumor? It's negative. Be happy." But yeah, it's one of the many things that lead to over-testing, and I think communities struggle with this, and there probably are too many CAT scans being done as a result of a concussion. But
So not falling is part of the preventative.
yes, and that is a big kind of ties into our guest from last week, Christine Reinke, and how important fall prevention is in the world of Medicare. It's part of our wellness visit, assess risk of falls and be aggressive about it. I'll refer people to physical therapy just because they're unsteady on their feet. Sometimes I run some basic labs. I like to run B12 levels. Medicare covers it for gait instability. I had to figure that out. They cover it for memory impairment and gait instability. They don't cover it for fatigue. So,
Although you can become fatigued by having a...
Yeah, I mean, I don't know,
So what are those kind of preventative measures as far as like wellness is concerned?
For fall prevention?
Yeah.
Well,
Can't have those like little rugs in your house, right? They don't want you to have
I mean, some basic safety interventions. Unclutter your home. Have your lighting be good. Yes, get rid of rugs that you might
throw
trip
rugs,
over.
right? They call them throw rugs because you step on them and they slip out from under.
Yeah, I don't like those.
Yeah.
Remember shag rugs?
Yeah, of course.
Well, they were a mess. How'd you keep those things clean?
But they were so cool.
I guess so. And then, you put some basic intervention at the home. For better or for worse, the Medicare Advantage plans are sending nurse practitioners into patients' homes to do an assessment. I find this redundant, and they'll say things to the patient like, we'll send the report to the doctor, and I'll get the report. But it's one of those things, it's like such computer drivel that it really is complete. It's a long report, and it's completely non-personal. It's just checking boxes. I don't find it helpful. But I like to think that they're in the patient's home and that they could do a brief intervention to decide if any changes need to be made. So just to finish up our topic on concussion, because I thought it was relevant, showed how it could happen to any age. Most people probably don't need imaging, but if there's any prolonged symptoms, evolving symptoms, or if you're over 65, you should have a CAT scan. Just remember that the CAT scan is done to rule out other pathology, not to diagnose the concussion. You kind of, in a way, diagnose the concussion because you didn't find anything else. And to take these head injuries seriously. Generally, with the sports world, because it's a complicated issue. It also is a legal issue because if a school district is not following guidelines, the ramifications could be serious. But usually, most school districts want an individual with a concussion to be without symptoms for about a week, and then begin a return to play protocol. So, that could take another week. So generally, if a high school football player, for example, has a concussion, he's out of the game for 2 weeks, at minimum. So that, in a 8-game season, that could be a tough thing, for a kid. I don't know about the long-term prognosis of football. I just think that, smaller communities are just one by one going to say, it's an expensive program, interest is going down a little bit, and the risk is there, and it's just what's going to happen.
Yeah, it's a tough one.
Yeah.
I think they could replace it with boxing.
You recommend boxing?
Yeah, right. That is one you haven't touched, but boy, that is really a tough call for sports.
I know. And when they tried to kind of tell us that the way Muhammad Ali was not because he boxed, that's a tough sell. Come on,
It's true.
Yeah. And we had a local celebrity, Floyd Patterson, lived in New Paltz. He passed away about 10 years ago. Mm-hmm. And he also had long-term effects of the boxing as well.
Yeah.
So, yeah. Although boxing and wrestling are kind of, one of the oldest sports out there, with just two people against each other.
Yeah, European football is soccer, and
right.
that I think is has a less average of severity with concussions. Is that correct?
Oh, soccer, yeah, but it still has it though.
It does, but not nearly like we have with football. Yeah.
And I wonder about rugby, and there's a whole argument.
Right, yeah.
I don't recommend we stop wearing football helmets, but the whole idea that maybe we're now, because we have the helmet, we're doing things that we otherwise wouldn't do.
Yeah, just like Seinfeld said.
Because rugby, look at that game. There's no helmets being worn in that game, and that's a rough one.
Okay, yeah, okay.
And I remember being a kid, growing up watching the Rangers and the Flyers and hockey teams with the long 70s flowing hair.
Yep. Mm-hmm.
No mask, no mouth guard.
That's right. Yeah,
it's amazing when you think about these things.
Yeah. Well, it's good. It's good that we're becoming conscious of all of these sports injuries that happen with your head, because it is long term.
I know.
Can be.
Yeah. Well, we'll discuss that maybe a little bit after the break, but we're going to go to our break.
Thank you, Dr. Eric Stanberg and Robin Baker. You have been listening to Kingston Community Radio, AM 920 and 92.5 FM, March 15th, and 19 degrees now here in Uptown Kingston. This last portion of Kingston Community Radio was brought to you by Central Hudson. And a little bit about the weather and forecast for the next 3 days. Monday, today, sunny, high to 36. And tonight, mainly clear, low down to 16. Tuesday, partly cloudy in the morning to mainly cloudy during the afternoon, a high of 40 degrees. And Tuesday night, variable clouds with snow showers, a low near 30. Yes, that said snow showers. Wednesday, cloudy with a high of 48, and Wednesday night, mainly cloudy, a low of 33. We'll be right back after these messages.
Thanks for starting your day with Kingston Community Radio on 920 WGHQ AM Kingston and 92.5 W223 CR FM Kingston, New York. Magic 92.5.
If you came across someone struggling with hunger, how would you recognize them?
By their clothes,
their age,
the way they speak.
Hunger can be hard to recognize. Learn why at IamHungerInAmerica.org. Brought to you by Feeding America, 200 Food Banks Strong, and the Ad Council.
Crispy, blazed, toasty, faded, lit. No matter what you call it, if you're high, you're too high to drive. Brought to you by NHTSA and the Ad Council.
Okay, man, this is your time. Maybe you didn't choose this, but you're here now. You're gonna go out there and be an all-star caregiver. Cook, clean, be there emotionally and physically. You gotta dig deeper. Drive them to physical therapy, doctor's appointments, because that's what caregivers do. Don't give up. Show the world that you're tougher than tough. Caregiving is tougher than tough. Find the care guides you need at aarp.org/caregiving. Brought to you by AARP and the Ad Council.
Don't. Just don't. If you see a low-hanging or downed wire, don't touch it. Don't move it. Don't go near it. Don't drive over it. It may be a power line carrying an electric current strong enough to kill. But here's what to do. Stay at least 30 feet away and call 911. Central Hudson will take care of the problem. If you come close to a wire, shuffle away with small steps and watch your step. Wires may be hidden in fallen tree limbs or near water. Your safety matters.
Hi, this is Dina Roy from Hurley, and I support the Kingston Community Radio, and so should you.
And we're back. Kingston Community Radio, AM 920 and 92.5 FM. And my name is Dan Gatis, and it is Monday, March 15th, 19 degrees here in Uptown Kingston. The last portion of Kingston Community Radio was brought to you by Central Hudson. The upcoming portion of Kingston Community Radio is brought to you by Herzog's. Do you ever think about what really matters at Herzog's Home and Paint Centers? Community, family, neighborhood, all matter. Herzog's employees have been a part of the family for years, and they value personal customer service and being close to their community. Stop by Herzog's Home and Paint Center in the Kingston Plaza for your home, building, and maintenance and painting needs, and discover the difference of buying local. And we now return you to Dr. Eric Stanberg and Robin Baker. Welcome back.
All right, thank you. Welcome back. Second half of this morning's show.
Good morning.
We really enjoyed that commercial about the pep talk for the caregiver. We thought
that is, I love that one. I actually do. It's put out by ARP, and it's a good way to go.
It's kind of funny because we were kind of talking about sports, So here you have the kind of like, you're going to go out there and you're going to get it done.
Yeah.
Take them to appointments and physical therapy.
Mm-hmm. What do we have in the birthday folder today?
We have a whole lot of nothing.
Nada. Oh, gosh. Okay.
Well,
just as a reminder, folks, you can send your birthday announcements in to Post Office Box 4364, Kingston, New York, 12402. And you can also email them to kcr921@gmail.com. And get them in, because we know you have birthdays, we know you're listening, and you're involved with your group and your family and your friends and your organization. Send them all in.
Yes, and that famous cow pie from Boyce Dairy Milkhouse will go unclaimed today. So please send us your birthdays. Sorry, so we talked about concussions. Shall we move on to another subject?
Sure.
Well, spring is you never know it. Dan and I started the morning by talking about how dark and cold it was. But spring is here almost. And what happens with spring? From a medical point of view, what's one of the things that starts coming up?
Allergies.
Allergies. Okay. Should we talk? Are you want anything else?
It's a very current subject.
Well, you want to talk about allergies?
Yeah, we're sitting here blowing our nose, and both of us this morning.
People, yes, in spring, things are starting to bloom, so they're releasing various spores and whatever. But allergies could be throughout the year, in the fall, for example, the things that are blooming are now dying off for the season, so they're releasing also what's been inside them. So you'll see in fall when the leaves are blowing around, things are also. And in winter months, for example, we're indoors a lot. A lot of us live in older homes where maybe there's some mold. You can't get rid of mold, and people go about the mold. You're not going to get mold out of a basement from a house that was built in 18 whatever.
Well, there's no dust at my house.
None, really.
No.
Wow,
so clean there. Yeah. I was
I'm
you're being
sarcastic.
Yes.
Yeah. No. So the idea that allergies is just kind of a spring thing. You can see it year round, and plus it's most people don't have a specific thing that they're allergic to. Dr. Reese would probably tell you that. He sees a lot of people. Dr. Reese is an allergist that works in Robin's office. Does a lot of testing, and frequently it comes up negative or shows an allergy to something that's completely irrelevant, like an Australian timber or something. So people will just have what's called rhinitis, which means runny nose, nasal congestion, post-nasal drip. Remember, it's got to go somewhere, So if you have a lot of congestion, it go at the front, and you'll have a runny nose, and you'll sneeze. It'll kind of just stay there, and you'll sound congested like me all the time. Or it'll go down the back of your throat and cause post-nasal drip, and you also sound like me all the time. You go, that type of stuff. So that could be a manifestation of allergy or just perennial rhinitis. It could be just kind of irritants. Dryness is a biggie, particularly in winter months. I always think about the wood stoves. Oh, aren't they great? They're so bucolic and, charming and whatever. They're very dry and really can cause some health problems. Yeah, even my hand is feeling dry just thinking about it. So allergies. So what do you do for allergies? Well, if you're lucky, you could figure out exactly what it is, and if you're even luckier, you can therefore avoid it. People might be allergic to dogs or cats, and stay away from dogs and cats. Dust mites, by the way, live in homes, and they're arachnids, to be exact, not insects. Who cares about that? But they're related to ticks. But they can, just frequent cleaning of the carpet, can kind of do an okay job getting rid of the dust mites. But the treatment-wise, I usually recommend an antihistamine. The classic antihistamine is diphenhydramine, otherwise known as Benadryl.
Makes you tired.
Makes you tired. And it actually doesn't last that long, lasts about 6 or 8 hours. So,
But a good thing to have around in case you get an allergic reaction, right?
yes.
Like as a mom, I always had Benadryl.
Yeah. It's I usually don't recommend it because I think it has a lot of side effects for allergies. But I do. Some people tolerate it. And they say it works great for me, and I want to take it. I say okay. But I usually recommend one of the newer generation antihistamines. The classic one is Claritin. These are all over the counter now. And I don't agree with that, by the way, but they are all over the counter. I think that these are medications that are complicated, have potential interactions, and I think that they should be supervised. Anyway, Claritin is loratadine. There's Allegra, which is fexofenadine. There's Zyrtec, which is cetirizine.
So what's the difference? Why would a person choose one over another?
They're all antihistamines. But the response of a patient to one can be variable. Someone could take loratadine and not have much benefit, and then that same person could switch over to fexofenadine and feel it works fine.
So what are these histamines?
Histamine is a chemical that has many effects. It's a chemical. It's a molecule. And one of the many effects is it increases nasal congestion, runny nose, sneezing, runny eyes. It actually causes itching as well. So people who have hives, which is another type of allergic reaction, is caused by histamine release. It causes flushing, redness. Some people drink alcohol, a glass of wine, they get the red cheeks, and even they can sometimes get a little itchy from it.
They allergic?
No, that's more of a histamine surge caused by alcohol, and that's kind of a more complicated thing. There's even something, I've never seen a case of this. I think it's called scombroid or scombroid. It's a surge of histamine caused by ingesting certain types of shellfish. That's it probably might show up on a board exam at some point. I should probably review that. Never seen a case of it, though. So the classic treatment for allergies is an antihistamine.
Yeah, that stuff in the shellfish is the same stuff that's in wine. That I forget what that's called. That can cause an allergic reaction.
The sulfites.
The sulfites. That's what it is.
Yes. Yeah. So wine will also kind of cause that, and some people may not have a good reaction if they drink wine. But anyway, so you want to take an antihistamine. With the other half of standard treatment for allergic rhinitis or just plain old rhinitis, people don't always understand, which is a nasal steroid. These are all over the counter now, too. Again, these are probably safer than the antihistamines.
So is that like a Flonase?
Flonase is the classic brand, fluticasone, but there's all other brands there, mometasone, I don't know, I lost track. These are really good medicines, but these work kind of over time. So, in my opinion, some people might have a quick reaction, like, I feel congested, I use Flonase, I feel better 2 hours later. But generally, I recommend regular use of this to kind of keep the symptoms in check. And sometimes people don't understand that. I'll recommend it, and then they'll say it didn't help, and I'll say, well, how often do you use it? They said, I tried 3 days. I say, no, I want you to stay on it longer. So the nasal, what I don't recommend, and there's a good example of things that probably should be taken off the counter, there are things like Afrin. Afrin is a decongestant for the nose. By the way, it works great. It works too well because the body kind of says, oh, yeah, so when the Afrin's supposed to wear off, the body surges. In other words, it causes a rebound effect. And people can get kind of get addicted to Afrin. Same thing happens to Visine with the eyes, and that's sort of what Visine is. It's a decongestant for the eyes, so it takes those blood vessels that are causing the redness and causes them to kind of close up, so the redness goes away. But then it wears off, and the process, causes a rebound. It's almost worse. So people can get addicted, so to speak, to things like Afrin. We call that. It's got a big word. It's called rhinitis medicamentosa. And the treatment for that is to get off the Afrin and onto like a Flonase. So, I don't recommend that. I mean, some people, you might see some guidelines saying, fine, 1, 2, 3 days, fine. But really, I just don't think a good treatment.
Don't go down that road.
I wouldn't. Though I don't know if I had one in front of me right now, I might be tempted because my nose is very congested.
So what else do you do? So you discover an allergy because you have a reaction, right?
Yeah.
I thought this was kind of interesting it was one of the things, and you can correct me if I'm wrong, but the only person who shouldn't get the vaccine is someone who's had an allergic reaction to the vaccine.
That's right.
So the only way to find out if you're going to have a reaction to this vaccine is to get the vaccine.
That's right.
So if you did have a reaction with the first one, you probably shouldn't get the second shot.
Right. An allergic reaction. That's different than having side effects from the vaccine.
Right.
And that's common in medicine, because we review allergies at standard. But when people say, I'm allergic to penicillin, when you ask them questions, they usually, I got an upset stomach. That's really not an allergy. That's a side effect. But so people can be a little confused by that. And common people will say, I have a bad reaction to the flu shot. I don't want to get the COVID shot. And I say, well, that's kind of like saying you don't tolerate bananas, therefore you're not going to eat an apple. They're really different things. So, I don't know. Sometimes that makes sense.
So we kind of have to wait for symptoms. I mean, as a mom, you go through this, just even introducing foods to your children when they're little. And
most of those are really not allergies either. Fruits, for example, can be a little acidic. So sometimes a kid might have a kind of a redness around the cheek and the lips, and therefore that gets labeled as a strawberry allergy or something when it's really just kind of some irritation.
Covered in hives and their tongue swells up.
Yes, that is an allergy.
What's that most common allergy for kids? They even have separate tables at school for it.
Oh, yes. And by the way, a topic of controversy. Okay, so you're talking about the peanut allergy. Because when they actually study it, a much smaller majority of people are really allergic to peanut. I think that you really got to make this diagnosis specifically. You got to send the patient's got to see an allergist, have proper testing, make a clear diagnosis of it. Not to suspect, you know what I mean? And Dr. Reese and other allergists are very well qualified to say, yes, this is a peanut allergy, a nut allergy, whatever. Yes, separate peanut tables. By the way, you're not really born with allergies. That's a tough concept for people to understand. Allergies are caused by antibodies. So you're not born with antibodies. The only antibodies you're born with are the ones your mother gave you through the placenta. And then that's one of the reasons, recommendations of breastfeeding is to continue to give your baby some antibodies. So you're not born with allergies. You acquire antibodies, and then some of them might behave dysfunctionally over time. So it's just an interesting thing that someone can become allergic at any point in their life, which can confuse people as well. Generally, as we get older, our immune system starts subsiding, which is in and of itself its own problem because it increases our risk of being susceptible to infections. But so generally, as we get older, the rate of allergy onset goes down, kind of for that reason. But you can become allergic at any point in your life. And then you can have kind of like, let's talk about bee stings, another common type of allergy. So you get stung by a bee. Yes, that's what happens for the next, immediately to 3 days. It's going to be red. It might swell. It's going to hurt. And then after 2 or 3 days, it will start to subside and go away. That's a bee sting. That's what's supposed to happen. Some people might have an exaggerated response to the bee sting. Yes, it swelled, but the whole arm swelled, for example. That might be a person who is acquiring more and more antibodies every time they get stung by a bee, to the point that the next time after that, they might have a major reaction, what's called anaphylaxis. So that's a tough call. What do you call an exaggerated reaction to a bee sting? There's no real easy definition of that. It's kind of like I know it when I see it. This is more than I think it should be. So that sometimes prompts me to recommend an EpiPen because you don't know what's going to happen the next time. And actually, unfortunately, there are some cases of something like that happening. And when the person ultimately has an anaphylactic reaction, not having a good outcome, those could be fatal. And the doctor's getting kind of sued and losing for not recommending that an EpiPen be available. So That's the tightrope that we're walking on every day.
Right, but you don't know until it happens.
EpiPen is its own topic. It's a basic medication, probably costs pennies, epinephrine. But it's this complicated delivery system that enables someone to give it to themselves or someone else very easily. It's a delivery system that's expensive, and it's the cost of it has gone up astronomically in recent years, beyond affordability for many people. And the epinephrine also has a shelf life, so you have to check it periodically, and if it's expired, you got to get a new one because it's not going to be effective if you need it. So it's been a really bad example of something very basic that's been out of the reach of people who might need it for cost reasons.
They never got to the bottom of that, huh? Like how EpiPens went from costing like $20 to $300 overnight.
I guess we lost interest. Yeah. I guess maybe it's not happening so much anymore because it's not making the news. But they knew what they were doing. Uh-oh. Say hi, family's watching. All right, so I was going to talk about Lyme disease as a thing of spring, but we went on about allergies.
Well, we can talk about both.
One final point about allergies. Who should see the allergist? We're not talking about anyone who has a serious allergic reaction should see an allergist. Anyone who just kind of has allergy symptoms and it's not responding to basic treatment with an antihistamine and a nasal steroid, or is open to the possibility of having injection therapy and wants to pursue that. That's a legitimate reason to send to an allergist. Good morning. We have a caller.
Good morning. Saturday I had my second shot, and I'm wondering, I'm not seem to be getting any reaction. The first shot, my arm bothered me just a little bit, and that was it, but I don't have any, and I wonder if that's normal not to have any reaction.
I mean, it's kind of good news in a way because the second shot can be actually harder for people to tolerate, and it does not mean that the shot was not effective. So I think it's just good that you tolerated the shot well. So I wouldn't worry about it.
Sometimes maybe it comes later. I only had it 2 days ago. That's what I'm wondering. Maybe
you probably should be experiencing some soreness in your arm, or when Robin and I had our second doses, we were kind of ill. I was ill for about a day, and Robin a little bit longer. So I think you'll be okay if it hasn't happened yet.
Oh, all right. Thank you.
All right, and thank you for getting your second shot.
And thanks for listening.
I wish everybody does.
Well. Yes, I think as far as that goes, there's going to continue to be improvement.
Yeah. All right. Thank you, Doctor.
All right, thanks for listening.
Calling.
Well,
so you think that those are the kinds of reasons that you should go see a specialist?
I
mean, all of us kind of suffer a little bit from some types of reactions to things. I mean, right? It's very common.
I'm thinking about it. Should I go see an allergist and have some testing and see? I just haven't done it. I mean, but the symptoms seem to be kind of getting a little bit worse as the years go on. So I'm thinking about it.
Treatment for allergies is kind of like, is it like a vaccine?
No, but it's an interesting concept because it's almost like homeopathy.
Yeah.
I don't know a lot about homeopathy except that they give you a very small amount of, say you're sick with diarrhea. They give you a very small amount of something that causes diarrhea that therefore decreases your symptoms of diarrhea. That's the basic principle of homeopathy.
Dr. Stamberg, I would like to ask you a question in regard to, resistance to allergens and things like that.
All right.
When I lived rurally, really out in the country and stuff, and I literally lived in fields and farms, and I had never even experienced any kind of like a hint of allergy. But now that I'm living in a more urban type of lifestyle, there are more allergens that seem to affect me. I'm just wondering if you're exposed to it on a long-term basis, and it's always around, and it always was, is that a way of seeing how allergens work?
Yeah.
If you're isolated from them, and then you hit it hard,
It could be.
Seasonally and things like that, it has more of an effect on you?
It's hard to really give a completely accurate explanation. It's also possible that you're when you come into a new community, you're naive. So
Right.
your body
Yeah.
starts to respond to it. And then over time, it starts building those more antibodies that then you start getting allergic to it. The allergens are everywhere. So in the city, you have, more pollutants, and then remember, there's also allergens and irritants. And irritants also can cause symptoms like this,
Right.
pollution, basically.
Yeah.
Smog, fumes. So it's hard to say exactly. I know that everywhere I've ever lived has claimed to be the allergy capital of the world. But I do know people, who go to like desert climates where there's just less in the air, drier air. Their allergies tend to be better.
Yeah, Arizona.
No
sneezing there. I bet they sneeze sometimes.
So the answer is all the above.
And you were just saying before that you
I
can
do
develop
understand.
allergies
Right.
too as you get older. You can develop, like you were never allergic to it, and then all of a sudden you are.
Right, and we used the discussion of a bee sting. You get stung by a bee, first time in your life. Your body has never seen it before. It makes a few antibodies. All right, they hang out. You get stung a second time, the body makes a few more antibodies. Maybe your third, fourth, fifth time, you get stung, and then now you got so many antibodies, they swarm. Like the bees, they swarm and they cause a significant allergic reaction called anaphylaxis, which is very serious. And
By
potentially
that
fatal.
explanation, like everybody should be allergic to bees then.
No, because it doesn't happen to everybody. But in the story of someone who's becoming allergic, that's kind of what's happening.
Oh, okay, I get it.
Yeah, it doesn't happen to everyone. And by the way, bee stings kind of like peanut allergy. When the great majority of people, only about 10 to 20% of people with bee stings are actually really allergy in quotes and are really allergic to it. But so I think it's a good idea to refer to an allergist and specify that diagnosis. There's a whole topic of what's called desensitization. If someone's penicillin allergic, for example, but they need penicillin to treat some condition, you can, almost like homeopathy, you can give it and subside the reaction, and therefore safely administer the vaccine. Your infectious disease doctors in your office do that very successfully. In the hospital setting to help people, get appropriately treated. So, but it's an example of kind of homeopathy and medicine kind of that we're giving a little bit to get rid of the reaction.
And that's what a vaccine is.
I guess so, but the vaccine
at
is
least
not
in
so
a
much
general sense, right?
I guess so. To me, the vaccine is what you're doing is giving a little bit, so then we make antibodies. So then, when we're exposed to it, we don't get it. In a way, when we're giving allergy therapy, we're giving the little bit to get rid of the antibodies, not to cause the antibodies, to kind of deplete it. So it's complicated.
Yeah.
And I think allergists are, they do good work. That and I think they're underutilized, by the way.
Right. And something we kind of all have in common. I mean, you ever met anybody who wasn't allergic to anything at all? Probably not.
Hard work.
Where are my kids?
Well.
So yeah, the allergy testing, you shouldn't be scared of it. I've had it done.
Did you?
Mm-hmm.
And what did it show?
It showed I was allergic to a lot of things, like grass and mold and dust.
So what do you did you wrap yourself in bubble wrap? And
No, they recommend things like a special pillowcase and, of course, making sure things are vacuumed and,
okay, basic household interventions.
Exactly.
Do you change your sheets once a week, vacuum a couple, every 2-3 days. Yep. Okay, common sense stuff. Open your windows when you can.
Yeah, we were able to do that last week.
Yeah, not this week.
No, too cold this week.
Yeah. All right. I think the main reason to refer someone to an allergist is to specify the diagnosis and see if they're a candidate for therapy, injection therapy.
It's also one more thing on that list of like, let's see if this is something, like if you're chronically stuffed up or you're like, I mean, having a sinus infection is different than having allergies, right, Doc?
Right, but first of all, they're commonly what's cross-diagnosed and maybe misdiagnosed. The allergy rhinitis is one of the many things that might lead to overprescription of antibiotics, for example. Doc, I have a sinus infection again.
And it could be just allergies.
Right, could just be allergies or just plain old-fashioned rhinitis, which means you got a runny nose, a stuffy nose. It's not caused by a specific allergen.
But we as the people that we are want to know why. We want to know why our nose is running, and we want it to stop.
Well, I blamed histamine. There are actually it's not just histamine, but something is stimulating this release of this chemical and other chemicals. And again, there are different causes. It could be something specific like an allergy, dog, pet dander, whatever. We're going to our break, or it could just be an irritant in the environment, dryness, pollutants, or it could just be.
So is a runny nose, your body is reacting wants to get it out? Like your body is, is that what's happening?
I don't know if that's accurate. I mean, it's not really a functional thing. We're not cleaning out our nose. It's a good question, but I don't really have an answer to that. We're going to go to our last break.
We'll look it up.
Okay, thank you, Dr. Eric Stenberg and Robin Baker. And it's now at the bottom of the hour, and you're with us on Kingston Community Radio, KCR at AM 920, 92.5 FM, WGHQ. Monday, March 15th, and 19 degrees here in Uptown Kingston. This last portion of Kingston Community Radio was brought to you by Herzog's. Because the colors and quality of paint you choose matters, Herzog's Paint and Design Center, located in the Kingston Plaza, is there for you, offering the largest selection of Benjamin Moore paints and the area's most complete line of painting supplies. Herzog's Paint and Design Center also provides color samples from Benjamin Moore paints, including the eco-friendly Aura line. Color decorating consultants and expert interior designers are there, ready to assist you in choosing the right colors. Visit Herzog's in the Kingston Plaza. And Mid-Hudson Valley weather and forecast one more time. Today, sunny, a high of 36. Monday night, tonight, mostly clear, low of 16. Tuesday, partly cloudy in the morning, then mainly cloudy during the afternoon with a high of 40 degrees. Tuesday night, variable clouds with some snow showers overnight on Tuesday, a low near 30. And Wednesday, cloudy with a high of 48 degrees. And Wednesday night, mainly cloudy, a low of 33. And we'll be right back.
Thanks for starting your day with Kingston Community Radio on 920 WGHQ AM Kingston and 92.5 W223 CR FM Kingston, New York. Magic 92.5.
Adopt US Kids presents What to Expect When You're Expecting. A teenager. Learning the lingo.
Today I'm going to help parents translate teen slang. Now, when a teen says something is on fleek, it's exactly like saying, that's rad. It simply means that something is awesome or cool. Another one is totes. It's exactly like saying, totally, just shorter. As in, I totes love going to the mall with Becca. Another word you might hear is jelly. Jelly is a shorter, better way to say jealous. As in, Chloe, I am like so jelly of your unicorn phone case.
You don't have to speak teen to be a perfect parent. Thousands of teens in foster care will think you're, rad, just the same. To learn more, visit adoptuskids.org. A public service announcement brought to you by the U.S. Department of Health and Human Services, Adopt U.S. Kids, and the Ad Council.
Hi, this is Shirley Stabe from Kingston, and I support Kingston Community Radio, and so should you.
And thank you for listening to Kingston Community Radio, AM 920 and 92.5 FM, and streaming online at mykcr.org. KCR's talk radio, and your call-in number is 331-9255. And let's get back to the on-air studio with Dr. Eric Sandberg and Robin Baker for this last portion of Kingston Community Radio. By the way, this next portion of Kingston Community Radio is brought to you by Ulster Savings Bank. Many locations throughout the Mid-Hudson Valley, one near you.
All right, thank you. Welcome to the last half hour. I want to thank the underwriters there. We Herzog's and also Ulster Savings Bank and earlier Central Hudson. Who did the first half hour?
We need more underwriters. So, the first portion of Kingston Community Radio didn't have an underwriter.
I was going to make a joke, but I decided not to. By the way, I wanted to, I used the quote of, talk about obscenity that, who said, I know it when I see it, and it was our United States Supreme Court Justice Potter Stewart, in case any Potter Stewart fans out there, but that was in 1964, he used it with a case. So we used it to talk about concussion, that it's not easy to diagnose it, but I know it when I see it. Not easy to define it. All right, final half hour, Robin. Let's talk about COVID. All right?
Okay. I
have a newspaper here. This is, the headline from Saturday's Daily Freeman, active cases of COVID-19 rise in Ulster and Dutchess counties. So Ulster County, as of Friday, had 1,618 cases, which was up 1,593 the day before. That's really only about 25 cases, if I'm doing my math correctly. And in Dutchess County, it went from 1,064 active cases up from 995. That's about 70 cases. By the way, we have more active cases in Dutchess County. So,
what do we do about that?
Well, we keep doing what we're doing. I am still confident that the vaccine situation is going to improve, and I want to encourage everyone to get their vaccines. I think there's two types of patients that don't want their vaccines. One thankfully is a lot more common than the other. The category one are just people who are nervous about it, and in a way they're willing to have other people go first. Okay, but they're, now that it's been out and we're kind of aware of what it does and everything, people are warming up to the idea and then willing to get it. And then, yes, there's a subset of people who are just against it. For reasons that probably aren't worth going into, except that I don't consider them valid reasons. You have any opinion about that? People who just don't want to get the vaccine?
I've mostly heard people saying they're going to wait. They're going to wait.
Right.
They want to see what happens or whatever. Make sure that everybody's okay, which, Dr. Tack was very clear to point out that everyone's okay.
Yeah. That's a little frustrating, but I'll say to patients, I got mine. I'm still here. There's Exhibit A. So you waited.
I'm your doctor.
Yeah.
You got to, if you ever were going to trust me, you can trust me now.
Yeah, and the supply problem is going to get better. It's just unfortunate that it is the way it is. But other places seem to be giving the vaccine out.
It has gotten better. Everyone that I know that was struggling to find a vaccine or get an appointment, they were able to get an appointment, get on a list and get a phone call. And I think we're doing a lot better in this area right now with the vaccine.
Yeah.
So just a little advice to get on I know CVS is giving it, Walgreens is giving it. All you have to do is call and they, the prompts on the phone lead you to where you need to go.
So you recommend that, in a way, Robin might have more exposure to this than I do, because people call her office and you're
I'm the scheduler.
Yeah.
Yeah.
So people also call and they say, Robin, give me some
advice. Do you have the vaccine? That's what they want to know.
Do you have the vaccine?
They want to know if the doctor's office has the vaccine. And we, as far as I know, when we were eligible to ask for a portion of the vaccine, we did apply. You have to kind of apply for it, say you want it. And I know that we did. As of right now, we still haven't received vaccines to distribute to our own patients. But what we are doing is directing them to the sites that they can do it. So the two big ones now, CVS, Walgreens, the Ulster County website is covid19.ulstercountynY.gov. And if you go to that website, you can get on a list. And everyone that I know that has gotten on that list has at least had their first vaccine.
Still stories of people traveling to other parts of, someone I know went to Binghamton and Potsdam.
Right.
And,
so they were willing to get, that vaccine. They wanted to get it earlier, so they went to wherever it was being offered. But I know, just in our own area, I know there's a local pharmacist. I think it's drneil.com.
Yes, Dr. Neil,
who was a pharmacist up in Woodstock, who was able to get, was proportioned vaccines and on a weekly basis. And he was able to, from very early on, distribute them and even set up a clinic, because it was not this past Saturday, but last Saturday at the Saugerties High School, where he also organized a gentleman said at his synagogue, member who called in?
Right.
He organized people going to their local synagogue and being vaccinated right there in their local synagogue. So I think that we have more vaccines now than we did 3 weeks ago.
Is there, so if someone could potentially sign up, on multiple sites, CVS, Walgreens, and the Ulster County site, for example. Is there any sort of, that you're aware of, any kind of cross-reference to,
Yeah, they think that some of the vaccines, the people, they kind of were having a problem with no-shows.
Yeah.
People had an appointment and they weren't coming.
Right.
So I think that if you're given an appointment, just to go sure to go back and
cancel the other ones.
Whatever,
Right.
if you had anything set up with anybody else.
Right. But it is our ticket out of this. The more people vaccinated, the better. The idea of herd immunity. People say, are we going to have to maybe get a booster? I don't know. Maybe we might have to get an annual COVID vaccine, like an annual flu shot. We don't really know the answer to that yet. Right now is get one dose. Wait, get both doses.
Right, depending on which vaccine you get.
Generally, okay. So remember, the J&J vaccine is just one dose. I have no idea why. It's also less effective, but effective enough.
Well, can you talk to the efficacy, at least because as opposed to the Pfizer and the Moderna shot is 95%, and then they were saying that the Johnson & Johnson shot was 65%.
Yeah.
But they also added to that means that you're covered, as far as I understand it, that you're covered up to 65% to not get COVID at all.
Right.
But it's 100% effective if you do contract COVID in keeping you out of the hospital.
Right.
So it was 100% effective at people not succumbing to COVID. So I think that's important to point out.
That is important. And then, we have a system that reviews this, and I think they're a little confusing with this emergency approval versus approval, but, I don't think the FDA would approve it if they didn't think it was a good option for us. I believe in I do have some skepticism.
Well, it's science.
At other times, but I think right now you're seeing a very healthy interplay of the government and the pharmaceutical industry to help with this problem. And it's nice to see, I guess.
Dr. Tack was very clear in pointing out that of the millions of people that have gotten the vaccine, there hasn't been one death. I mean, people come up with, they found outreach, the stories on the very outskirts of people who had become ill or afterwards, or was it just
there are
rare,
some reports, but they're not enough to draw any conclusions, and they're very rare. I mean,
and then on the other hand, he'll say as soon as he's done saying that
Right.
no one has died from the vaccine, he'll say 500,000 people died from the virus. So.
Yeah, and I wonder where we're going to top out at when this is over. I mean, I still look at the daily statistics, and it's about 1,000 a day national fatalities. The overall case numbers are down. Articles over the weekend about spring break in Florida, kind of being more spreading events. Some states really lifting restrictions. Without clear explanation. Very, very, very frustrating.
I think something that's also been frustrating this whole time is the fluidity of the guidelines, because they keep changing. And even now, like the guidelines, like how do you help someone who has to travel, or help, that they have to get tested before they get on a plane, and then are they quarantined and then tested at their destination site, and then do they then get tested again before they can get back on a plane to come back to New York, and then quarantine and then get another test before they can come out of quarantine. I mean, these are all good questions.
Right.
I wish that there was like just one place where we could get that kind of information and have it be accurate.
I agree. I mean, some of it is, the way our country's set up. We're 50 states rather than, one country. So we always kind of allowed variation on a state-to-state level. So I just would like everyone to work together on it. But I agree to have that thing kind of in place. I still think it's a good idea if you're traveling to get a test 2 to 3 days before you leave, and to get one, and then to lay low, and get one around 3 days after your return, if you leave the state. It came, at urgent care of the weekend, there was some testing going on, a fraction of what there was, about 2 months ago. But, still people exposed at work, someone tested positive. Generally, if you're with someone and you get tested, and then you're not, say you're exposed to that person was 4 days ago and you're testing negative, it's kind of, it depends, how, what do you mean by with that person? There's different degrees. You live with that person, or you worked with that person, and then you were in the same room with them for an hour or whatever. So, depending on the level of exposure, I sometimes say, if it's been 4 days and this test is negative, you're okay. By the way, the test takes about 2 to 3 days, so then you're at around 6 or 7 days. So before the clearance is really given, and I emphasized the need to continue to wear the mask and distance and so on.
Any new eligibility? New people that are eligible for the vaccine, as far as you know? I mean, as of the 15th, I'm getting the dates wrong, but
what?
When the patients needed an eligibility letter from their doctors.
If someone's over 65 or older, they do not need a letter of eligibility. That's been a source of some unnecessary phone calls. You meet criteria just by your age. But if you're less than 65, you need a qualifying condition. And for that reason, you need to get a letter from your physician or doctor's office. And the list of qualifying conditions is rather broad. Just being overweight, BMI greater than 30 counts.
Cancer, diabetes,
high
blood pressure.
Obvious things like lung disease, diabetes,
immunosuppressant.
Even high blood pressure, is enough to make it. So anyway, but if you're if you're 65 or older, you do not need the letter. What are you fun about?
Oh, your dad says I have a nice smile.
Oh, you want to say hi to my father?
Hi, Artie.
Hi, Dad. And
so 65 or older, you don't need.
Right.
If you're younger than that and you meet one of these criteria, you do have to call.
Yeah.
And hang in there, because there is a lot of calls coming in.
Yeah. I'm usually pretty quick with it. I try. I understand. It doesn't take a lot of time on my. I put the reason in the note. I don't know if that's entirely necessary.
You're not requiring an appointment to get an eligibility letter.
No, I'm not. No.
Right.
But unfortunately, there are a few people where I just said I don't see you meeting criteria. I'm sorry. Younger people, so someone asked for one for fibromyalgia, for example.
Yeah, that's not on the list. I don't think that's on the list.
Not that I saw.
Yeah. But hang in there. I mean, if you don't meet the criteria yet, you will.
Right.
Because it'll be opened.
Yeah. I wonder what it's going to be like if we ever start to give the vaccine at our office. I think it's a good idea, and I wish I was able to do it. I'm also a little nervous about.
Onslaught?
Onslaught, lottery system. I don't want to. I want it to be objective and fair as possible. First come, first serve, and if you qualify, that's fine. But I want people to behave appropriately. I don't want people to,
pushing, shoving.
Right, and that makes me. I guess when I haven't heard many reports about that yet. So,
no.
I guess maybe my concerns are ill-founded.
I agree. So the eligibility also opened up to restaurant workers.
Okay, more frontline workers. So there you go. That's a change.
Yes.
And by the way, makes tremendous sense.
Right.
And we're keeping our fingers crossed that the nice weather enables restaurants to do more work outside again. Right?
Yeah. They're still doing like a lot of their just, staying afloat is takeout and but I had a couple over the weekend that was their first time out in a year.
Really?
Uh-huh.
And they came
Yesterday.
to the restaurant?
Uh-huh.
Wow.
I mean, they had gone to restaurants and sat outside before, but this weekend was their first time sitting inside.
Were they an older couple?
Uh-huh.
Do you know if they were vaccinated or they?
Yes.
All right. So
And making a big announcement about it.
they walked in the room and
Happy
they said,
to
"We're
be
vac-"
out, and they kind of just shared it with me as their server, but they weren't wearing signs or anything.
Yeah.
But no, they were glad, and they felt good about coming out. And
We had a fair number of coming out parties at Le Canard.
Really?
Over the weekend as well. Some people that have been vaccinated and feel more comfortable on coming out as a family. It was, it's kind of like a coming out party.
Well, yeah,
I think that's just going to get better and better, honestly.
So my stepmother, Marcia, has texted that the Amazon delivery people should give the shots. We would all be immunized by Friday unless you have Prime, then by Thursday. Very funny. I don't understand what Amazon Prime is. Do you?
Yeah, I don't know. It's very popular.
People talk about it.
All the girls at work use it.
All right.
Everyone's talking about this whole past year has been like a shopping.
Well, you and I just finally understood what streaming TV is anyway. So we're watching a little on Netflix and
a little behind.
Yeah,
that one.
My kids would say, Dad, you should watch Netflix. I was like, all right, what channel is it on? And then
They're like, you just don't get it.
Channel 4, Eric. Channel 4.
Oh.
All right. So sum up our morning. So we
sum up our morning. We did have a guest schedule, but she was unable to make it, unfortunately. We will reschedule her for the summer. And we talked about some general topics. We talked about the general preventative health of women, primarily women of reproductive age. We spent some time talking about concussions, which was a hard-hitting subject. Laugh at the jokes.
Oh, he's funny.
Yeah. I hope the
allergies.
We do have a caller. Good morning.
Hi. So I've volunteered a few times at the Kate Walton Fieldhouse for the vaccines.
Okay.
And quite a few people that I talked to after they got their first vaccine had told me that they're scheduled someplace else to get their first vaccine. And the people that I knew about, I tried to stress to make sure that they canceled it. But a lot of people, I think, they're not canceling it because one person said to me, "Oh, I thought the state did that." So I just wanted people to be aware if they schedule themselves. Some people schedule themselves several different places. Sure that they cancel that.
Right. It'd be nice
And
if
the
I
other
agree
thing
with
is,
them.
I don't know if people can find out ahead of time. Like there was one person that had to stand in that huge line, and he was on prednisone, and they had to turn him away. So I don't know if that information, when they register, if that's in there. But just an FYI, I hate to see people get turned away when they've waited.
So one of the reasons to not give the shot over at the field house is if someone is on prednisone.
Correct.
Okay. What if they were recently on prednisone, like last week?
I don't know what the time frame was.
Yeah.
I think it was about several days. I mean, that's what the person told me. I didn't actually research it myself, but he was acting on it. He was going to be on it for another day or two, and they had to turn him away.
Yeah.
Or, obviously if they have any kind of injections of any type, but just so that they know ahead of time, so they'll, avoid all that stress getting there. And
are there still a problem with kind of no-shows over at the field house?
No, I think there was over 1,100 people there on Saturday. That was
wow. You guys gave 1,100 vaccines on Saturday?
Yes.
Wow,
yeah.
That's tremendous.
Yeah, so they, but my concern, like I said, I just want to make sure people cancel, what they have scheduled, because
right.
You don't want somebody to lose a spot if somebody else can get it,
Right.
And so that's really important. Just
it's good. Yeah, it's important to point out. So, we're asking people to be kind of
diligent
and not occupy 2 spots.
Right,
or even 3 spots. Again, it would be nice if there was a centralized
most people
location.
are very grateful to get their first vaccine, and really, it's a good experience. So it's kind of nice to see.
Yeah.
Thank you for volunteering. That's wonderful.
Thank you.
Thank you for listening.
Okay, thanks.
All right, bye-bye.
She makes a very good point. There are several medications. Do you know exactly what they are? That are they're asking you to either stop that medication for a week before your vaccine. And I thought that Dr. Whites had told us at our office, he's the rheumatologist at our office, that it was only high doses of prednisone that were restrictive, not low doses, doses lower than 10 milligrams did not apply. But I don't know exactly what that criteria is. Are different sites having different criteria?
I think the criteria should be the same, and they probably defined by the health department, but maybe there might be a little, overinterpretation of the criteria.
For us, it was like immunosuppressant drugs that just to be off of those for a week before to give your own immune system, right? So they're not bugging up against each other.
Is that what Dr. Whites is recommending?
That's what I thought the criteria was. It wasn't really up to him. It was just that's what the CDC was saying. Like I said, I'm not exactly sure, but that the caller mentioning that to get your appointment and then to wait in line only to be turned away that's tough to take. So hopefully, if you're on medication, maybe just ask when you're booking your first vaccine if there's anything that's going to jeopardize your chance at getting the shot.
So I was able to look this up from the AARP, and I'm skimming it right now. If you are taking a blood thinner, because this has come up, the FDA recommends informing the vaccine provider, but that's not a contraindication.
Right.
Okay, so remember that. So I'm not quite sure what the vaccine provider is supposed to do, except be a little more careful.
Be aware of it.
Yeah. But you should still get the vaccine even if you're on a blood thinner. You probably have a higher risk of bruising. You got to keep pressuring the site a little bit longer. Use the smallest possible needle. There's some expert that they quote here says even you could consider skipping 1 dose of your blood thinner, but check with your doctor before doing so. I'm skimming this very quickly. So we'll have to review this for the next time, okay?
Yeah, so it was prednisone, and then there was also talk of if you are taking immunosuppressant drugs, like if you have RA.
I am delaying. I caught myself delaying people who I would otherwise want to give the pneumonia shot to, Pneumovax, till to the fall, saying I don't want this to interfere with if you get an opportunity to get your COVID vaccine.
Right, because you can't have those in succession, right?
Yeah. Right, they don't want anything interfering with the immune reaction to the vaccine. So theoretically, if you've recently had a pneumonia shot, your body's trying to respond to that, and maybe it would interfere with the reaction to the other. So I'm trying to look up some other recommendations. I'll have to revisit this at the next show, okay?
Yeah, we'll get those statistics for you, and we'll have them next time.
All right.
But just check with your doctor, and then when you're booking your appointment, ask those questions.
I did have a patient who I was going to prescribe maybe a Medrol dose pack to, a very gentle steroid, and he said he had his vaccine next week. I said, well, let's try to do without it then, So, but we should review those recommendations in light of a rheumatologist, by the way, would have a lot of people on low dose prednisone, like 5 milligrams. So and by the way, they need it because they have a condition. So it's a good point to make. All right, I think we're done for the week. We thank everyone for listening. Robin, thank you.
Thank you, Doc.
All right, and hello to my family, and thanks, Dan. Thanks, Maxwell family. I don't think we're here next week or the week after, so we shall see you in April. Take care.
Thank you, Dr. Eric Stanberg, Robin Baker. It's now 8:59, and you're with us here at KCR, Kingston Community Radio, AM 920 and 92.5 FM. It's Monday, March 15th, 23 degrees now here in Uptown Kingston, and this last portion of Kingston Community Radio was brought to you by Ulster Savings Bank. Many locations throughout the Mid-Hudson Valley, a location near you. Thank you for sharing the morning with us, and on our live streaming at mykcr.org, talk radio at its best. Live streaming and our inspired discussions of, by, and for the community. We invite you to keep up with us every weekday from 7 to 9 a.m. And until tomorrow, we wish you every success in growing and developing Kingston and all our neighboring communities. We now return you to Magic 92.5.